Navigating the healthcare system can feel, well, pretty daunting. It's so easy to feel like you're just along for the ride, right? Like decisions are being made for you, not with you. But what if I told you there's an official guide, a playbook designed to completely level that playing field?
Yeah, I think we've all been there, sitting in that doctor's office, trying to find the right words to explain what's going on, or trying to make sense of a diagnosis. You just feel overwhelmed, maybe a little vulnerable. Well, guess what? There's a framework here in Australia that's specifically designed to change that exact feeling for good.
Yep, there's literally an official toolkit. It's a framework designed to empower every single one of us when we're getting healthcare. And this isn't some secret, dusty document hidden away in a government office. It's meant for you. It's called the Australian Charter of Healthcare Rights. And look, this is not just some vague, fluffy set of ideals. It's a super practical guide that applies absolutely everywhere you get care in Australia. We're talking your local GP clinic, public and private hospitals, even your physio or other allied health providers. It covers the whole shebang. And this entire toolkit, this whole charter, is built on a foundation of just seven fundamental rights. You can kind of think of them as the 7 pillars holding up your entire healthcare journey. So what are they? Well, here they are. Access, safety, respect, partnership, information, privacy, and the right to give feedback. Now, over the next few minutes, we're going to dive in and break down exactly what each one of these actually means for you in the real world. All right, let's kick things off with the first 2 rights. These really are the bedrock of any healthcare experience. I mean, these are the absolute essentials that everything else is built on top of. So the Charter says you have the right to access healthcare. Now, that sounds pretty simple, right? But it actually covers a ton, from making sure you can get care no matter where you live, all the way to understanding the costs that might be involved. And when we talk about access in a hospital, this is where it gets really practical. As a public patient, you can get treatment at no cost. But if you go private, you might get more choice over your doctor, but there are going to be costs. The key thing here, the really crucial point, is that it's your right to choose which path is right for you. Okay, let's move on to that second pillar, safety. And honestly, this one is completely non-negotiable. It means the care you get has to be safe and high quality. It has to meet national standards, be based on the best evidence out there, and be delivered by people who are properly qualified to do it. But here's the thing about safety. It isn't just about what the doctors and nurses do. It's about your role too. If something feels off, if you're worried or you think something's been missed, you have the right to speak up and ask for a clinical review. And let me tell you, that is such a powerful tool to have in your back pocket. Okay, so we've covered the basics, right? Getting into the system and making sure it's safe. Now, let's get to the real heart of the conversation, that back and forth between you and your healthcare provider, because this is where you really get to step into your role as a partner. So the next 3 rights, respect, partnership, and information, they really all work together, like a team. It all boils down to this. You should be treated like a whole person, not just a collection of symptoms. Your culture, your beliefs, your personal choices, they have to be respected. And you're meant to be an equal partner in the whole process. And to do that, well, you need clear, easy to understand information. And all of that, it all leads to one of the most important, one of the most crucial concepts in all of healthcare, informed consent. Now, this is so much more than just signing a form. It's a whole process. It's about you voluntarily agreeing to a treatment. But, and this is the big but, that decision has to be based on a crystal clear understanding of everything involved. We're talking the good, the bad, and the ugly. So, how does that actually happen? Well, your doctor or clinician has a very clear process they have to follow. First, they've got to discuss your condition clearly. Then they need to explain all the different options. After that, they have to lay out all the risks, the benefits, and yes, the costs. And only then, after all that, can they ask if you agree to go ahead. And here's something really important to remember. Giving your consent isn't a one-time, locked-in deal. Nope, you have the right to change your mind. You can withdraw your consent at any time, even if you've already said yes. Your permission is always the final, necessary step before anything happens. All right, we're on the home stretch. Let's talk about the final set of rights. And these are all about protecting your personal space and, really importantly, empowering you to use your voice to make the whole system better for everyone. Okay, next up is privacy. And this one is just fundamental. It covers everything. We're talking about the privacy of your own body during an exam, all the way to making sure your most personal medical records are kept secure. The bottom line is this: your health information belongs to you, and it absolutely must be protected and kept confidential. And now for the final right. And honestly, this might be the most underused one of them all: the right to give feedback. And here is the most crucial part. You can do this without any fear of it backfiring. Your quality of care cannot, I repeat, cannot be negatively affected just because you spoke up. Please don't underestimate the power of this. Your feedback is maybe the single most powerful tool you have to improve care, not just for you, but for everyone else too. Think of it like a gift to the system. A compliment? That tells them what's working so they can do more of it. A complaint? That shines a bright light on what needs to be fixed, making things safer and better for the very next person who walks through that door. So, when you pull it all together, when you look at all 7 of these rights, a really clear picture starts to emerge, doesn't it? The whole point isn't for you to just be a passive patient. The goal is for you to be an active, informed, and respected partner in your own healthcare. Okay, let's wrap this up with the key takeaways. If you remember nothing else, remember these 4 things. First, these 7 rights. They're your tools, so learn them and use them. Second, you are an equal partner in your care. You are not a bystander. Third, your voice, your questions, your decisions, they matter. They are absolutely essential. And finally, number 4, remember that you are always in control. You can change your mind about your care at any time. Which leaves us with just one final question for you. Now that you're armed with all this knowledge, what are you going to do with it? What's the one question you're going to ask, or the one thing you'll seek clarification on at your very next appointment that will help turn these rights into your reality?